Hello, friends. This is Devangi Dalal. I'm an audiologist and speech therapist. You have been a wonderful audience, and you have heard, talk shows with different professionals, and have heard talking to me all the with hearing impaired kids, where we have spoken about the diagnosis, treatment, precautions, and many more things. Now, in this talk show, we have speakers from all around the world, and today I have Dr. Judy Huch, a speech language pathologist. She's a wonderful lady. She has worked so much in her audiological profession, and one common thing between us is both of us started practicing in 1991, and also we have been participating in uh, public awareness in American Academy of Audiology. So now I'm going to invite Dr. Judy Huch. She is dispensing hearing aids since 1991. As I said, she graduated in 1993 from Central Missouri State University with a master's in audiology. She did in 2008 her doctorate from Etistel University. She's also appointed as a governor of Arizona as a state commissioner for the Arizona Commission for the Deaf and Hard of Hearing in 2016 and is currently serving her second term. Uh, because of her work, she is also into a board of Arizona Audiology Coalition and serves as a chair of American Academy of Audiology Task for Public Awareness, which where even I am with her. It's honor to work with her. Her nonprofit division, that is Grace Hearing Center, provides hearing aid healthcare to underprivileged children in southern Arizona. She was also awarded as fellowship with the OPAD project in 2017 and Humanitarian of the Year from NT State University alumni in 2019. She is Woman of Influence for Community Service in Tucson and Woman of Impact of Southern Arizona both in 2019. Wow, what a wonderful achievement, I'm so happy that you have joined me on this talk show, and we are going to talk about pediatric audiology to all the parents who have hearing impaired children, and also government will be listening to this. So welcome you, Judy, for this talk show. Hi, Judy. I welcome you on this show, and first of all, namaste from India.
And thank you, and good morning for us. I know it's the end of the day for you all. Thank you for having me.
So, Judy, we are doing a lot of work in pediatric audiology, you in US and I in India. So, I would like to know that how much importance the pediatric protocol and neonatal screening in, when we are dealing with the hearing impaired children, because that's what yet we have not started in India. So I would like to know that how important is the hearing screening for the growth of the hearing impaired child and for the life ahead.
Yes, here in the US, since the 1990s, we have had universal newborn screening. And as soon as the child is born, they are supposed to have their hearing screened in the first 3 days of their life. We catch most of them, but not all. If they fail that screening, they're supposed to have another screening before they leave the hospital. And if they fail that, then go to see an audiologist. We probably miss about 5% because many children are born at home or with a midwife in a woman's clinic instead. So we're working on it, but it's much better than it was 25 years ago.
So it's 1990, it's almost 30 years.
30 years, that's right.
Oh, that's fine. I mean, we are doing neonatal screening in India, but it's not mandatory in all the hospitals yet. So it's still the age of detection is 2 or 3 years in our country. So we also have to work hard for that.
Well, we know that other countries that it just doesn't happen in many other countries. So that's why we step up the education.
Yeah, Judy, it's 30 years, the neonatal screening has started. And in our country, still, the age is unlimited of screening. And, yeah, we have not yet started with having a neonatal screening mandatory in the country. So that's where, we are working on it. Now, when we come to know that, the child has a hearing impairment, how important is the parent's role in growth of the child? I mean, how and where the growth that parent's role starts.
Immediately, the parents, the child's adults are the best teachers throughout their life. We know that. And um, they function as a coach and expose the child to everything. Sometimes the parents have a hard time accepting that there is a hearing loss and how to move forward. But we know the most important place to start is with communication. And here in the US, we have American Sign Language. And starting that immediately is important. Then they can progress through the testing and talking about hearing aids and cochlear implants. But the first 3 years are imperative to get information to the brain for verbal speech. And here in the US, there are different conversations that we must have between the deaf culture and the hearing culture, and where the child fits in all of that. But we want the parents to learn sign language as they learn through the process with their children.
I mean, do you think that, I mean, especially when I worked with 29 years with the hearing impaired children, I see each and every child has some residual hearing. So do you think that we should insist on the sign language, or it should be more of a verbal language?
Well, why can't it be both? I both of my boys, I taught sign language. They're both hearing, but it cut out a lot of frustration with them when they were trying to tell me they were hungry or they were hurt, and they could sign to me before they could verbally say it. So I'm a believer of both.
So you feel that they should learn the sign language and all as well as the verbal language.
Yes.
Okay. So that helps them to grow much faster.
It helps with communication, certainly, and um, the child being able to communicate so they're not as frustrated. Toddlers can get very frustrated when they aren't understood.
I know. So I mean, how do you find out that the child is struggling? I mean, do you do any counseling to the parents and tell them that how one can work with the child?
Yes, there's a lot of things in the school system here will start speech pathology at 3. But if we identify a hearing loss early, we can get them connected with some state services. Because if the child's older, they might show anger and frustration and have more mood disorders. We know that depression is higher in children with hearing impairment. They are more susceptible to abuse. So we want to make sure that not that the parents hear their child, and that's not just with their ears, but with their heart. and to take away the frustration of the child trying to communicate with them, because there can be behavior challenges if the hearing loss is not addressed.
So you feel that apart from doing all the activity or teaching a child a language, it's all equally important that emotionally they get connected with the child.
Emotionally connected with the child, yes, on every level, because again, the parent is the best teacher for their child. So yes.
So once the child, like you find out that the child has a hearing impairment, so what all precautions you guide parents to take, to do the development of the child? I mean, what is the procedures which you follow?
As soon as a child is identified, here in the state of Arizona, we do have to report that to the state, mostly so the resources are started. The state, and that's part of the commission that I'm on, the Commission for the Deaf and Hard of Hearing. They make sure that the parents have resources of where to find speech pathology, where to find if the audiologist, if we didn't happen to know a surgeon for a cochlear implant, if that was needed. But there are resources in Arizona that are set aside to make sure that the parents have access to somebody coming in the home to help them either with sign language or just how to play with their kids and how to communicate with their kids, but in their homes instead of having to come to the clinic. So each state has their own fund to make sure that deaf and hard of hearing children have access to these resources.
Oh, that's very nice. I mean, the state itself helps the parents, So, I mean, does it different for the people who can afford or people who are underprivileged who can't afford the services, or it's the same service for everyone?
For children, the state will provide help. If for some reason the child slipped through the cracks, that's where we have the nonprofit, because people don't have to have funds to come see us. The manufacturers have worked with us very well. Phonak and Oticon especially have given us hearing aids at no charge to fit children. So most of the time it's taken care of, but every once in a while people just slip through the cracks, and we just want to make sure that they get help quickly.
Okay. So, whether the child is screened, who are from the whichever family it is, the state provides the facilities, and if they don't have money, then they get the services through the non-profit organization, and
Mm-hmm.
even the hearing aid company does help them.
Yes.
Oh, that's nice. And what about the speech pathology? I mean, even for that, they do the help.
The state does do the help with that as well. There is such a long list for speech pathology that sometimes for the people who can afford it, they hire a speech pathologist on their own. But the state will provide those services for all of the children.
Now here, when we talk about the non-profit organization, people concentrate that how many children are fitted with the hearing aids, not concentrating on what exactly is required for the child, because every child's residual hearing is different. So how the state, gives the hearing aid to each and every individual in a different way, or any research is done, or any testings are done and given the hearing aid to them, or it's given in general, some of the hearing aids to the children?
Well, there are state clinics, and I just remember the acronym CHIC, um, Children's, and I'll have to look that up. I can't remember the name, but it's downtown in Tucson. Most of the time when we identify, they're able to get the hearing aids at no charge to them from the clinic, and then they come back to us for follow-up. But if some children need more in-depth testing like ABR, the hospitals, there's 3 hospitals that will do that here. And then the real ear is always done on the children, and follow-up is every 3 to 6 months, basically until they're 18. But they can choose to stay at the state clinic, CHIC, or they can come to ear, nose, and throat, or a private clinic like mine.
Okay. So, I mean, the technology is improving. So, how the technology is paid attention in fitting the hearing aids to them?
Yes. So Oticon and Phonak, again, are probably the 2 types that are fit the most because they have a very good pediatric software and fitting. So, and most of us all talk to each other, so we make sure that everybody's taken care of. But it is very good hearing aids that that the state provides. Yes.
So, they are diagnosed individually, and they are given the hearing aids also individually.
Yes.
Okay. So that helps them to have a good development, and faster understanding of hearing. So the auditory verbal therapy, how important it is, I mean, when you deal with it.
The speech therapy,
Yes.
it's extremely important, and most of the time they incorporate, the parents too. It's not just the child doing the work, it's the whole family doing the work, because the speech pathologists give them homework to do in between. But depending on where the parents are, if they want to do verbal and sign, then that's used along as well at the same time. And I stress that because the deaf community is very strong here in Arizona, and they want to make sure that their culture is kept alive. And so that's something that we have to be very sensitive to, as well as getting verbal language going. So it's easier to get a job. It's you can make more money, and all of those things that that can be challenging hurdles for the child, because they go to school in the exact same classroom as all of the other kids do. They don't separate them out anymore.
So, as you're working as the governor for the Arizona University for the deaf children, so when the state is helping the children, so is the help is throughout their career till they reach to their employment, or it's only up to some years? I just wanted to know that.
Up to 18, but there are programs to help through college, to make sure that maybe an FM system or a remote mic but also the the ADA, the American Disabilities Act, that employment has to provide, um, whether it's an amplified phone or caption phone, or equal access in the workplace as well. So there are resources throughout life.
And when you are working with the non-profit organizations, like what all things are done through the non-profit organization for this underprivileged children, or prevention or awareness camp, what exactly a non-profit organization does there?
Um, One of the biggest things with our nonprofit is we had gotten a grant for oral rehabilitation. So with children and adults, just how to be better listeners, um, and all the tricks that we say, controlling noise and slowing your speech down. And but we have uh, 3-session classes with books that we have a grant to do, so that and the prevention, as well as fitting hearing aids. So that's most of what our nonprofit does. And then we connect with other nonprofits to make our resources go farther.
Yeah, so we also run here a non-profit organization, Josh Foundation, and we have helped till now 1,200 underprivileged children. So what we exactly do is that we approach all the special schools here. Of course, we don't have a FM system and the facilities which your state provides. But then what we are doing is, through the non-profit organization, we are providing the hearing aids to their requirement, and then we work on their rehabilitation. But here the difficulty what we are finding is that we have so many languages here. So the language is a little difficult to manage. So how do you find there? I mean, is the language a problem, or everybody learns the English?
Most everyone learns English. There is a strong Spanish population here. And so I have uh, an audiologist who is fluent in English, Spanish, and sign language. So she does it all. But most of the time, they'll bring a family member to interpret. Like, unfortunately, I have not learned Spanish very well yet. And so we'll work with the family that way. But there's also a lot of work in schools. If English is the second language, then speech pathology comes into play as well. So if there's a hearing loss on top of that, then there can be more challenges, yes.
So you do find challenges, or what challenges we find here?
But
uh,
you have more.
yes, yeah, more challenges. Yes, of course. One more thing which I found it is that your state university is providing hearing aids testing facilities. Is there any program for the parents as well, if they want to learn how to communicate with the child?
There, there are, and I know that the Arizona Commission for the Deaf and Hard of Hearing, they'll do sign language classes with it, and then with the speech pathologist, they'll always work on the verbal side of things. But the encouragement, there are different places around the state, and Phoenix and Tucson are the 2 largest cities, and we're probably small compared. There's only 1 million people in Tucson, but Phoenix, they have it's a much larger city. So there are pockets of places that will teach sign language to the parents and work with them and the children. But the speech pathologist, when they go into the home, that's the verbal one-on-one, which works better for them.
So there is no program for the verbal therapy for parents in state.
I am not aware of a class, an overall class. So I may have to research on that one, but it's mostly, the classes are mostly for sign language and then one-on-one classes with the parents.
Yeah, and so the state provides one-on-one classes for each and every child.
They'll do in-home services, yes.
So those home services, like how many speech pathologists, like if you take a very Tushan, your small state, how many speech pathologists must be there? Just wanted to have that idea.
That I'm not sure. There's a lot, though, because uh, there are 30 that graduate every year, and most of them want to stay. So there's quite a few, um, but like Tucson Medical Center, before the pandemic, they had a wait list of like 1,500 people. It was a huge wait list. So we still need more.
Oh, so in India we need so many to help, because individual level is right now not possible. So right now, the school, the teachers are there who are able to help the children, and teaching parents how to go about it in the school. The one thing in India, like when I'm working with George Foundation, most of the parents, like if we do a good hearing aid fitting, and we communicate with the parents, how to work with the children, but most of them, we are able to work on the verbal approach, auditor verbal therapy, and they are doing really well. So yet, as far as Jewish Foundation is concerned, we have not worked on the sign language. We have insisted more on the verbal therapy to them. And of course, some of the percentage of the children, very little hearing and having other issues than hearing problems, do we find difficulty, but most of them with verbal therapy are doing well. So now, when we are talking about pediatric audiology, it is very important that we screen the children earlier. We give them hearing aid to their requirement. We start doing a therapy and rehabilitation program for them. So in throughout this journey up to having education and then having employment, what message do you want to give it for the children and for the parents?
That the parents are the child's best advocate, most important advocate through their whole life. I know I would do anything for my kids, and they're practically adults. But to also find ways to meet your child where they're at, and just work on understanding them with grace and gratitude, and just be patient with them, because the way the technology has come along just since we've started, 30 years ago, um, it's astounding at the doors that have been opened, and to encourage your kids, because they can do anything with your encouragement and love.
Yeah, we also like feel that if we work in a systematic manner with the children, they can achieve like any normal child can achieve. Yeah. So,
Yes.
one last questions, that you have worked with your children, as you said. So, how old are they, and what exactly, the magic point which you have used with your kids?
Well, my I have two boys, and one is about to turn 20, and he is serving in the Marine Corps. So I don't have him in at home anymore, but he will be home for Christmas, and so I'm very much looking forward to that. And then our youngest son is 17, and he's about to graduate from high school, and he's trying to figure out next steps. Um, but with both of them, we had to have tubes in their ears when they were around 1 because they had so much fluid. And that's part of why I did the sign language with them is they had ear infections so much that it was frustrating for them too. But now they're huge young men, and I come up to about there on them. But Rick and I are about to be empty nesters, and so we hope that we get to go back out into the world to do the humanitarian trips with Theos, and that's what we're really looking forward to.
So now you work with your kids, so now you want to help other people.
Yeah, it's been instilled in me to help other people since I was born. My parents, they really pounded that into me that I'm to use my gifts for others.
Oh, that's very nice. So I feel that you must be believing in spirituality as well.
Yes, I was brought up Catholic, and so I've decided to live my faith out loud, and that's where the nonprofit Grace Hearing Center. That's where the name came from, and but it's others come first. So yes.
That's nice. I think again, as I said, that we have two things in one common. That we started practicing in 1991. We also serve for American Academy, and we also do a humanitarian work. And we both of us believe in having faith in God. So this is something, really wonderful to talk to you, and you have helped us to give a lot of information to people that hard work pays. If we really do in a systematic manner, in audiology field, and with our working in the field, we can also do a humanitarian work. You are a real nice example for that. So thanks a lot for joining and having a wonderful talk show. And I hope that listening both of us will help a lot of other people to have a confidence in their own working as an audiologist, and as well as parents will have a faith that we have someone who can help us to overcome the challenges in life.
Devangi, thank you so much for having me. It's been my honor and my pleasure. Thank you.
Thank you so much.